You stay up late to finish one last task, or spend an extra hour scrolling on your phone in the dark. It feels like a standard trade-off in a busy life. A morning coffee might mask the grogginess, but it cannot stop the underlying physical stress accumulating in your cardiovascular system. Currently, more than 1 in 3 adults are getting less than the 7 hours of sleep required for basic heart maintenance. Millions are walking around with a growing cardiovascular deficit they cannot feel. This chart tracks the risk of coronary artery disease relative to sleep duration. Dropping your rest to 5 hours or less increases the risk of developing the disease by 200 to 300%. Skipping sleep forces the heart to function without its primary window for physiological recovery. During healthy sleep, nocturnal dipping naturally drops your blood pressure 10 to 20%. This lower pressure allows the parasympathetic nervous system to activate, repairing microdamage in heart tissues. But when you cut sleep short, blood pressure maintains its elevated daytime rhythm straight through the night. Without the drop in pressure, the sympathetic nervous system stays active. Your body remains locked in fight or flight mode even while you are trying to rest. Because the body is denied its natural recovery period, it treats a single sleepless night as an immediate life-threatening crisis. Reacting to this perceived threat, the brain rapidly floods the bloodstream with stress hormones, specifically cortisol and adrenaline. These hormones signal the blood vessels to constrict. The passageways narrow, forcing the heart to pump with much higher force to maintain circulation. Moving blood through these restricted pathways is physically demanding. The heart's overall workload increases by up to 40%. This mechanical stress interferes with the heart's delicate electrical rhythm. The signals that coordinate each beat become chaotic and unpredictable. You may experience a racing heart, sudden morning blood pressure spikes, or uncomfortable palpitations throughout the day. The heart is now operating like an engine redlining without a cooling system, transforming minor electrical misfires into the foundation for long-term failure. While one night of stress is taxing, repeating this cycle for months or years leads to permanent structural damage. The friction of persistent high blood pressure, combined with cortisol-driven spikes in blood sugar, creates systemic inflammation inside the arteries. This inflammation rapidly attracts plaque, which builds up along the arterial walls and narrows the passageway for blood flow. This silent deterioration is how chronic exhaustion physically transforms into major conditions like coronary artery disease and heart failure. Sleep apnea presents an even more acute danger. The airway physically closes during the night, prompting the brain to trigger hundreds of micro-awakenings to keep you breathing. This chart shows the immediate toll. As oxygen levels fall, blood pressure and heart rate violently spike in response. This cycle triples the risk of a heart attack. However, the cardiovascular system is highly resilient. Restoring a consistent 7 to 9 hours of sleep can halt this damaging chemical cascade. Proper sleep functions as a physiological requirement that naturally lowers the resting heart rate and allows for the repair of vascular damage. You can begin resyncing your internal clock by maintaining a strict sleep and wake schedule. Cool your bedroom to 65 degrees and prioritize morning sunlight exposure. Limit heart-straining substances by observing a strict 2 p.m. cutoff for caffeine, giving the nervous system time to transition into a restful state. For those experiencing persistent insomnia, nighttime chest pain, or loud snoring, lifestyle changes should be paired with professional medical evaluation. NexIn Health provides over 14 years of clinical excellence, offering non-invasive, integrated care for both heart and spine wellness. Listen to your heart's silent warning signs. Contact the experts at NexIn Health today to reclaim your sleep and secure your cardiovascular future.